Hello Milan, how are you?
I'm good, and you?
Good, good, thank you. So, can you tell me what is the reason for you to come here today?
Yeah, well, I'm just having difficulties on my shoulder, you see.
Mm.
And I got a big competition in a few weeks coming up, so I just kind of want to get that better
Okay.
before that. Like, it's kind of I get a kind of dull pain, and it's like there's a feeling of giving way, kind of now and then.
Okay.
It's just I'm not as confident in movement as I was before.
Okay. Does it really limit you a lot in your sports?
Yeah, quite a lot because it's the fast acceleration movement. It gets a bit painful, and in that I'm a dancer, so like I need it quite a bit.
Okay.
I'm lifting up my
Do you do a lot of training regarding your sports?
yeah, like 20, 30 hours a week, a lot. So
Damn, that's a lot. Okay. Okay. So now I'm gonna proceed to the screening question. So it's just 9 questions to see if I have to refer you to the GP or not for your health, which means basically that physiotherapy is not a good indication for treatment for you.
mm-hmm.
So did you have a recent trauma?
No, it's not really from a trauma. It's just like slowly came
Overuse?
on. I don't know. I don't
Okay.
use maybe.
Okay. An unexpected weight loss, like around 5 kilos in a month?
No, if anything, I've gained weight. That's so.
Okay.
But it's like roughly the same.
A recent fever, inflammation? No?
Nothing.
Nighttime pain?
There's a bit of difficulty sleeping on it sometimes, but sometimes
Yeah, sleeping on your
Yeah.
side is okay.
I don't tend to sleep on that side anymore. So yeah.
Okay. So, okay. Not really like, but like if you sleep,
Oh.
sleep on your back.
It's fine.
Okay.
Nice.
You use of corticosteroids?
No steroids.
Okay. Some neurological symptoms, like you have deficit in like controlling your arm, or you think that something spreads throughout your arm.
No, it's just kind of the pain is in the same area in my shoulder.
Okay. Do you have a history of cancer in your family?
No, not that I know of.
Okay.
Nothing.
A drop of mood or a general feeling of unwell-being?
Pardon?
A general feeling of unwell-being or a drop of your mood.
Yeah, for sure, mood. Yeah. It's just because I'm very dedicated in this dancing, and if I can't, there's this big competition.
But like in general in your life.
Yeah, I would say so. Yeah, it's kind of like my mood's gone down. Not necessarily like the depressive mood. Yeah, of course, but like I'm just a bit frustrated.
Okay, because of the
frustrated and stressed just because of the injury.
Okay. Good. And the last question would be like, are you capable of reducing your pain? So, for example, if you move a bit of this way, it can be better, or it's really like, no,
Yeah.
I can't do anything, and it's always painful.
No, it's just it's on off. So sometimes if I do like a fast acceleration movement up there, like it can be
Okay.
more painful. But yeah, typically it's comes and goes.
Perfect. Okay, so you told me that you do 30 hours a week of your sports. You are really dedicated. Soon a competition.
Mm-hmm.
Can you describe me more the sensation in your shoulder? So when you are on and off the training, because you said that it was a dull feeling of the shoulder.
Mm-hmm.
Like, can you tell me more about it? Or
Yeah, it's just so it's always in the one sort of area. Yeah. It normally happens after or during or after training.
After? Okay.
If during or after.
Okay, both.
Yes,
So,
yes. But Sometimes, yeah, when I'm throughout the day, if I'm just performing, like if I'm lifting up my backpack, or if I have to, my mother lifts something heavy, a heavy shopping bag, I do get the same sort of sensation,
Okay.
but
Which type of sensation do you have?
that dull pain in
Okay, we go.
in the same
Okay.
area.
Okay.
But it's like maybe it's a moderate pain. I wouldn't call it absolutely severe. It's like maybe a 5 or 6 out of 10.
Good. Okay, that's what I was about to ask you.
Okay.
Okay. Great. And so after and during the training, does it change the way that you like your perception of the pain? Like, is it like more painful when you do in training, when you do
Yeah,
after training?
The 5 or 6 out of 10 is typically that just right after training.
Okay.
Normally it's like a 0 or a 1. Sometimes you just know it's there.
Okay,
It's not too
good.
bad.
That's
It's like
positive.
it's a
Okay.
1.
So it's really when you start like to go really in big movements, when you dance, that it starts to. Okay. 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 Good. And in your daily life and your daily activities, how does it affect you? In what extent?
Yeah, I mean, well, first of all, it causes me a bit of stress because it's something that is very important to me doing. This dancing, these trainings, and that are quite important. And I've since been like trying to avoid as much overhead movements as possible.
So you try to avoid as a.
Yeah, it's a little bit so. Yeah.
Okay.
Yeah. What else can I say? It's obviously not ideal, but I think there are worse scenarios to be in.
Okay. So you still are positive about your situation. Like you think that it's not that hard and like you can heal from it, or it's the opposite.
No, I think it's something that can be treatable. I can understand. I think almost anything is treatable, but
Okay.
yeah, it's just difficult.
Okay. And do you have anything that can impact you on like from your environment?
So, do you mean by that like family
Like,
and friends?
yeah, family, friends, so your club of
Yeah.
dancing, because
Yeah,
if you
yeah.
do at a high level like this, maybe there is some pressure in the club, so.
Yeah, there is pressure on me to perform, of course, but I have plenty of support from my parents, my friends, my siblings. They all say, yeah, they just like it is what it is. If you miss it, it's okay. They say like stuff like that.
Okay.
Um,
And what evocates you in this situation? Like, how do you react to that? For them saying that, okay, it will just pass and.
I mean, I just don't think they can't put themselves in my shoes. Like, I don't think they can really empathize with me that well. It's like, I don't think they know how much this dancing means to me.
Okay.
So it's a bit, yeah, can be a bit irritable when they say, it's fine. So yeah.
Okay. Okay. And so, like you told me that, so in your daily life, it affects you because you can't no more like do fast movement, hang out the groceries.
Yeah.
So like, you can like if you have your arm like standing there, like you already feel something because you told me 0 out of 10, but maybe you have a discomfort feeling or.
It's like I can feel it's there, but it's not like.
It's not painful, but
It's not painful. It's just like. So imagine like a fly on your shoulder. You know it's there, but it's not going to cause you harm or anything.
Okay. Okay. And so you're a student?
Yeah. Yeah. I study in physio in college, or no, I study biomechanics in college.
Okay.
Biomedical engineering in college.
Okay, and so does it affect you like when you are still studying, because biomechanical you have a lot of practice in biomechanical?
Yeah, well, I'm a first year student, just so I mean, yeah, I'm also
Okay.
I'm
Like since that you feel some restrictions in like what you do in general or something?
Yeah, I mean, not so, it was more specific just to my just to the sport, but
Okay.
again, yeah, sometimes the stabbing, this sort of stabbing, shooting pain, I should describe it as more, comes up with certain movements, but
Okay.
it's mostly just instigated during the
Okay. But it does not like trigger the same
no it doesn't
pain
trigger.
and like intensity as you are dancing and really practicing for sports. Good. Okay. Okay, that's a positive point. Okay. 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 Do you have any questions or requests?
Do you have any idea what it could be?
For me, at first, after noting everything that every information that I had from you, I think it's just probably just general instability. First, like I need to guess which region is affected by the instability. I have one question. Are you flexible a lot? Yes.
Yeah, 100%. Yeah.
So which things you can do?
Shall we demonstrate the splits right
No,
now?
we will do it right after. But like basically,
Yeah.
can you bring your thumb because I can't? Can you bring your thumb like this, and like really touching your. Then okay.
Is that good?
Yeah. Okay. Okay.
It's more
Okay,
so normally my shoulders and my arms are very flexible. Hips, knees.
And you said that you had the feeling of giving away or something.
Yeah.
Oh.
I said that. Yeah.
Yeah, so for me it's clearly just instability in general due to I think that you are hypermobile, so like you have general hypermobility, so which means that basically your joints are limited by the capsule of your joint to not really go like beyond what it cannot do, and so basically like do this I cannot reach further, but when you are hypermobile your joint can really go further and further than me. And yeah, so there is I will ask you some questions about it right after. So to recap, regarding your personal opinion on yourself, you are stressed and frustrated about the competition and that you are really injured and you will maybe not be able to do the competition. But despite that being like you still think and believe that your case and general shoulder condition can be treated by physiotherapy, and that yeah there can be positive issues. You try to not solve but at least attenuate your problem by just avoiding movements in general or regarding your shoulders.
It's kind of like a I don't know, say I'm scared to do, just because that giveaway feeling might trigger something.
Okay.
Like a dislocation type thing, like.
Oh, okay.
I'm scared. I don't think that will happen, but I think it's just like.
Yeah, no, if you have the feeling, yeah, like it's.
Yeah,
of course, yeah. Regarding your environment, you mainly have a certain pressure on you for your dancing performance regarding your club and general friends, siblings, and family that are not really empathite.
Well, they yeah. I think they think they're saying the right things, but it's just not.
Oh, okay.
It's not
but
what I want to
it's
hear.
not well formulated.
Yeah, yeah.
Okay.
It's just not what I want to hear, basically.
Okay. Okay. Yeah, understandable. Yeah. Regarding your general body function, capacity, and structures. So during your practice, you have a pain around 5 to 6 out of 10. So during and after training, but after that, next to that, you have pain between like 0 to 1 in your daily activities. The pain is dull and sharp, and you can like show me really where is the pain. Yeah, not painful. so it is a 0 to 1 out of 10, but it's not it's not painful. It's not painful, but you feel that it is there. The activities. You said that you have nothing to signal, and like basically what you can do every day. You have no difficulties except in certain movements.
Yeah.
Movements and participation. Yeah, stopped dancing and just assist the classes and okay. And so your request for help for me to act is trying to help you on recovering fast enough for your competition that is in 6 weeks.
Yes, that's correct.
Perfect. Then we go to the examination phase.
Okay, great stuff.